What exactly is sickle cell disease? And why does it affect some people more than others? Can it be cured or only managed? And why do so many myths still surround it despite decades of research? From beliefs that it's a curse to confusion about who can pass it on, sickle cell disease remains one of the most misunderstood health conditions, especially in parts of Africa where it's most common. On this episode of Untangle, we are asking the big questions. How does sickle cell disease really work? What is early testing? How is it important? And what options do patients and families have today that they didn't before? Let's separate fact from fiction and unpack the realities behind sickle cell together. Welcome to Untangle. I am Amadine Ogbewe. Welcome back. We've been joined now by an expert on the matter to break down this issue, talking about Dr. Imam Abubakar. He's a public health physician at the Center of Excellence for Sickle Cell Disease. He's also a member of the CESRTA and of the University of Abuja and the Participatory Action Cycle Lead of the PACS project, which stands for Patient-Centered Management of Sickle Cell Disease in Sub-Saharan Africa. Welcome to the program.
Thank you very much.
Well, thank you for coming. There's no better person to have on the program here. So we'll go straight into the details. What can you tell us about sickle cell disease, basically for someone who doesn't know or who's confused?
Okay, thank you very much for having me. Sickle cell disease is an inherited blood disorder where the red blood cells become rigid and their shapes turn to sickled forms, or something we can call a crescent or like a new moon, and these become easily breakable. They break down fast and prematurely.
So like a C?
Yes, like a C.
So what is it meant to actually look like?
It's meant to be like a donut, okay. Like a donut. I think that's just a better way. It's not supposed to be spherical like full moon or like a ball, but rather like a donut kind of. So that's how it's supposed to be shaped. So these sickled red blood cells actually break down easily, and once they break down, they tend to block blood flow, especially to very narrow blood vessels like the capillaries, thereby causing pain, causing jaundice, and also causing other problems, maybe even up to leading to stroke. So these are what the sickled red blood cells do.
So what's causing this? What's the reason this is happening?
So once an individual inherits, the sickled gene from both parents, he comes down with the sickle cell disease, which is hemoglobin SS. There are other variants like hemoglobin SC, like hemoglobin S-thal. All these are variants of sickle cell disease. But once this happens, the sickle cell disease comes about and the individual has the disease. So that changes the form of the red blood cells, making it rigid and easily breakable. Yep. It's meant to be very flexible and pliable, but once it is sickled, then it becomes rigid and easily breaks down.
Okay, so two questions there. You said inherited, which means the parents had it. Where is the origin of this? And then the next one is, what are the differences?
Okay, so an individual that comes down with sickle cell disease definitely must have inherited it from both parents. So the two parents can be carriers, that is carrying the sickle cell trait, having genotype of ASAS. So each parent eventually contributes an S, and the child now comes down with SS. So if you have parents that are ASAS, for every pregnancy, they have 25% chances of giving birth to a child with sickle cell disease. By 25% chances, I don't mean if they are going to give birth to 4 children, only one will be sickle cell disease. No, in every pregnancy, the probability manifests. So 25%, they could have or 25% of times, the child could come down with hemoglobin SS. In 50%, it could be AS, that's same carrier, or it could be AA in the remaining 25%. So it is not advisable for parents who are AS to marry, because once they do, that chance of having a child with sickle cell disease is there. And in every pregnancy, that 25% chance is there. In fact, a family can have all their 4 children being sickle cell disease or being AS, but no one wants to take the risk.
That's fair enough. So is it simplistic to say that the preventive care for sickle cell disease is to not have both 2 carriers marrying? Is that really the long and short of it?
Exactly. So that's why we do genotype testing to check one's genotype. So we now say once both intending couples are AS, they are not compatible to marry. They shouldn't marry. So that is the message.
We have examples of some persons who have identified as sickle cell or patients of sickle cell who are living well enough. And people say, if this person is okay, why should I not marry the person I love? So what do you say about that?
Yes, in life, in reality, there are extremes to everything. So sickle cell disease, in most of individuals, it comes down with severe pain. It comes down with high risk of, getting infections. It comes down, with jaundice, that's yellowness of the eyes, anemia, even
and is all this from childbirth?
Yes, they can start from as early as 3-6 months after birth, when the maternal hemoglobin should have gone down. That's the mother's hemoglobin should have gone down, and the child is having its own, so it begins to manifest. So now going back to the talk, why people should not, go into marry and then intend to have children with sickle cell disease are those factors I have mentioned. So if a child is going to be having severe, intense pain every now and then, the agony is so much that no one, not even a parent, would want to see a child go into that. So if you have 1 or 2 having mild form of the disease, that does not justify that one should go into that. Although with proper, with early diagnosis, with frequent attendance to hospital and follow-up, and then taking adequate medications and prophylactic drugs like vaccinations, an individual can live very well even though they have sickle cell disease. So those are managements, those are improvements that have come, after a long time of research and efforts by, scientists. So those things are there. They can live to every potential any other child can have, but with proper early diagnosis, follow-up, and also sticking to their medications.
So would they avoid all of the pain and all the symptoms we've mentioned already through this regimen? Yes,
it is very feasible that there are certain, developments and discoveries. There are drugs like hydroxyurea, which reduces the frequency and the severity of the painful crisis. So these drugs increase the amount of fetal hemoglobin that are in the body. And those fetal hemoglobin do not sickle, which means the individual will not have the painful crisis that the sickling causes. So an individual or a patient on these drugs tends to have prolonged, period without crisis, without those painful crises and other things. So yes, there are a lot of things, and then prophylaxis like penicillin prophylaxis, the paludrin that is taken to prevent malaria.
What are all of this doing?
All these are preventing certain infections. Because as we mentioned earlier, the sickle cell disease patients are at high risk of getting infections more than, people that have normal hemoglobin. That's hemoglobin AA.
Okay.
So with drugs like penicillin, it prevents them from getting certain infections that are caused, by certain organisms that the spleen is supposed to handle. But because of prolonged insult on the spleen in sickle cell disease patients, they are prone to these diseases. So they serve as prophylaxis, preventing them from getting those diseases. Okay, and then things like the hydroxyurea, as I mentioned earlier, increases the fetal hemoglobin F in the sickle cell warriors, okay? And then reduces the frequency of the crisis and even the severity of the crisis. So even when there is crisis, it becomes very mild.
All right, fair enough. Basically, they can still live a normal life. But yes. The question now is, when you mention early detection,
yes,
but then you say that symptoms can show from about 6 months.
Yes.
Naturally, isn't that early detection already? If you already know something started from that young of an age, or are you saying there are instances where a person can live so long and just think that their episodes are something other than sickle cell disease?
Exactly. In fact, we have a lot of patients that are discovered to be sickle cell disease only in their teenage. Yes, nobody knew they were sickle cell disease.
But they must have been experiencing the pain.
They might have been experiencing some form of the pain. Some could be quite mild. Okay, so you wouldn't know. But again, the chances that they can get very intense pain or episodes if they predispose themselves to certain triggers is still there. So the fact that they have not experienced that doesn't change the fact that they are sickle cell diseased warriors or patients. You understand? So, but if you have the early screening, which we call the newborn screening, and this newborn screening program is taking place in our center, the National Center of Excellence for Sickle Cell Disease Research and Training. We have over 25 sites across the country, various teaching hospitals, various federal medical centers, and even primary healthcare facilities that are carrying out this newborn screening, and it is free. It is free. So an individual gets to know the genotype of the child as early as from birth to 6 weeks of birth. Okay. And once that is done, the child is enrolled into care. And we begin to observe and see what are the things the child would come down with. And the child begins to get his prophylaxis for those, infections I mentioned earlier, and get vaccinations like the meningococcal vaccine, the pneumococcal vaccine, conjugate vaccines. All these are vaccines that the sickle cell disease patients do take. And then it improves their longevity. It improves their quality of life. Okay? So it is very important that this is known early enough, not waiting until marriage or until they begin to have symptoms. In fact, for some, once they begin to have those symptoms, we begin to think of certain myths. That could it be a traditional thing? Could it be that somebody is causing this on my child? Could it be that my children have been dying before the age of 5? Somebody is responsible for that. But once the test is done early enough, you know that this child is sickle cell disease, and you embrace the care and prolong the life of that child.
Indeed. I want to posit a personal theory of mine. Please don't quote any authorities here. Yeah. I've often thought, some traditional beliefs where we see stuff like Abiku or Banje, as they are colloquially called, yes, of a child coming repeatedly, dying, yes, and returning, yes, that could be linked to some of these more scientific causes.
Yes, that is very true. In Africa, and not just Africa, in various cultures, we tend to describe things in the way we best understand them, not necessarily what they really mean or what they really are. Because children with sickle cell disease are bound to die early without intervention. When they are not diagnosed, nobody knows their state, and they begin to have, crisis starting from hand and foot syndrome, where the hands and the feet begin to get swollen from about 3 to 6 months of age, and nobody knows what is happening. And then the child begins to have his red blood cells broken down. The eyes are yellow, begin to have some what we call sickle cell fascie. You have frontal bossing, we have the teeth changing in terms of their position and all that, and even the growth of the children slowing down compared to their peers. So these children are bound to die early. So once they die, another child is born. If it's also sickle cell disease, he also passes through the same process and dies again. So some cultures feel or believe about reincarnation, where a child dies and comes back. So that is what might explain what those cultures believe. But it doesn't mean that the children are coming back. It just means that they are having the same disease that is responsible for the demise of the former child.
Fair enough. Due to time now, we'll go on a quick break. And when we return, we'll head into the second segment where we might just be having our quick fire session of frequently asked questions and debunking possible myths around sickle cell disease. Don't go anywhere. We'll be right back.
Culture connects us beyond borders. It's a bridge between traditions, creativity, and the future.
Culture is alive, shaping identities and communities every day.
Art tells stories of resilience and vision.
Artists blend tradition with innovation.
Cultural preservation creates sustainability and empowerment.
Culture evolves and adapts.
Music and dance unites communities through movement.
And right here, in the heart of our cities, artists and creators are keeping these cultures alive.
On Culture Cove, let's explore,
celebrate,
and preserve the arts and culture that define us. All right, welcome back. Dr. Imam, let's go straight now into some frequently asked questions.
Okay.
People who have sickle cell disease, can they get married and have children without fear of passing it on?
Well, yes and no. The first part of the question, yes, they can get married, they can have children, they can live a happy life. However, not passing it on, it's when they marry partners who are hemoglobin AA. That is their own SS combined with the AA or the S, they will always contribute. Since they have SS, they cannot give anything than the S at every pregnancy. So if the partner is AA, we begin to have AS, 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 AS. And then, so that is not transmitting the disease, but just the trait. But if they marry someone who is AS, then a lot of the children, 75% of the children are going to be SS, while only 25% are going to be AS.
But are there any new aspects of research where two carriers can have, I'm not talking about probability now. They do it in a way, because we've seen some testimonies like that. Two people, AS, come together and they have their child. The first child is AA or AS and so on and so forth, and they have no sickle cell children. Are there technologies or...
Yes, there are certain technologies. There is what might be referred to as form of in vitro diagnosis while the child is still coming up. But we don't normally advise that because it's not usually available, and then there are a lot of chances or risks for failure. So, but the probability is what has been established. When an individual inherits the disease or inherits the AA or inherits the traits through the autosomal recessive form of inheritance, which is, having that 25% AA, 25%, SS, and then 50% AS. So those technology are there, but they are not readily available for the general public. In fact, most people cannot afford them. And even where they can be afforded, they are not 100% sure that they can actually happen.
All right. So it's still safest bet is to just avoid
ASAS.
All right.
Yes.
So the next question now is, you can confirm if it's a myth or not, there is an idea that sickle cell disease only affects Africans. Is that true?
This is a myth, actually. It's not only affecting Africans. Yes, it is more prevalent among Africans. But we also have sickle cell disease in Asia. We have sickle cell disease, in Middle East, in the Arab countries, and other parts of the world. In fact, where people intermarry, the world is a global village now, and you marry someone from Africa, even if you are, for example, a Caucasian or a European, one can actually begin to have those traits go there, and then begin to also manifest in those climes. So it's not only disease of Africans, even though it is more prevalent in Africa compared to other parts of the world.
All right. So quickly, let's talk about the cost of living. Or you've mentioned how someone with sickle cell disease can still manage to have, a normal life, prophylaxis, all the vaccines and all of that. Is this cost friendly? What does it take? And then can you tell us about what is available for people who have sickle cell disease to help them, buffer or make up the extra if it's an expensive procedure or living, so to speak?
Okay, for every disease, not just sickle cell disease, there is cost of having that disease in terms of managing it. When an individual has or is ill or sick, he definitely gets to the hospital and then he gets treated. So the treatment, of course, costs money. Now, for sickle cell disease, because of it's a disease of the blood, and then it becomes, continuously, it's part of the individual. So the risks of hospitalization is very high. So they have frequent hospitalization. And for every crisis they have, they rush to the hospital, get admitted. They miss their schools if they are children. They become absent at work if they are already working class. And then they tend to miss out on certain social activities because of the hospitalization or the risk of hospitalization. And then the cost of management is high, starting from, treatment of infections, blood transfusion, buying the life-changing drugs like hydroxyurea, and several other things. So it's actually capital intensive managing sickle cell disease. So the PACS project, the acronym stands for Patient-Centered Sickle Cell Disease Management in Sub-Saharan Africa. So managing sickle cell disease is no longer a thing of the consulting room alone, where the doctor just prescribes drugs and the patient or the caregiver goes out to buy drugs and that's all. It has gone beyond that in terms of we must have stakeholders involved come together, understand the disease, bring in their views, and these views are heard, and then they modify the management. So in the PACS project, we have a component of the community, that's the participatory action cycle, where we have teams, 6 teams in the FCT, in various communities that are selected for this project. And members of these teams include patients, include caregivers, the parents of the patients, include community leaders. It's not just take this pill and you must take it. No, they tell you this is what we feel. This is how we feel we can be better treated. And then that helps, and
it also refines the process of how they will be treated in the future.
Exactly.
All right. Exactly. Thank you so much, Dr. Imam. It's been a very enlightening one. Thanks for enlightening us today.
Thank you.
That's how we round up the program for today. We have been talking about sickle cell disease. I do hope we've successfully untangled it and you do understand a thing or two about how the process works. Do be part of the advocacy as we go forward. See you next time. I am Amadine Obere.